Thanks for tuning into another lesson from Swallow the Pill. My name is Zena and I have been a nurse for the last 14 years. My goal for this channel is to be able to give you the knowledge that I have so that as a patient you can better advocate for yourself and the healthcare choices that you're making. The lesson for today is aimed to help patients to better prepare themselves for invasive procedures that they may be having soon. Thank you for tuning in. Like and subscribe. 1. Know what procedure you're having and do your own research about it. Don't just depend on the doctors to give you all of the information concerning the procedures you're having. Do your own research. Have your own knowledge surrounding the procedure that you're having, because sometimes they might not tell you all that you want to know. So make sure you're doing your own research and you have your own list of questions, especially whenever you go into the office and you're doing your consent. Make sure you ask questions and make sure you have a clear understanding about what they're going to be doing to your body. Don't just depend on them to give it all to you. You do your own due diligence concerning your body and do your own research and have your own questions for them. 2, don't be afraid to ask your doctor questions concerning the procedure that you're having. It is their responsibility, the doctor, to make sure you have a clear understanding of everything about the procedure prior to you signing consent. You should not sign a consent form unless you completely understand everything about the procedure. So don't be afraid to ask the doctor questions. There's been numerous times where I, as the nurse who works in a procedural area, I go to pick up the patient, and as I'm rolling in, they have very important questions that was not covered, nor that they understand. So make sure you're asking all of the questions before the procedure, before you sign that consent, because if you're signing that consent, you're saying you completely understand and you completely agree with everything that the doctor has told you. And if you don't completely understand, there is no way that you can completely agree. So make sure you're not afraid to ask questions. It is the doctor's job. So therefore, you have that right as the patient to make sure that the doctor has answered all of your questions and that you completely understand what is happening with your body and what they're doing to your body. 3, make sure you review your current list of medications that you are currently taking with your doctor prior to the procedure. There could be medications that you are currently taking that they need you to stop days ahead of time, such as Eliquis or Coumadin, that make you more susceptible to bleeding. Those need to be stopped at least 2 or 3 days ahead of the procedure. Also, you could be on some blood pressure medications that could affect you during the procedure. So sometimes they might have you take it the morning of. Sometimes they might have you hold it the morning of and resume it after the procedure. So make sure you go over your list of medications with your doctor prior to your procedure. That way you have a clear understanding of what you're currently taking, what you should stop, and then when should you resume those medications. It is the doctor's responsibility to cover this with you, so don't be afraid to make sure you go over your current list of medications. 4, talk to your doctor about any forms of anesthesia that you are assuming will come with this procedure prior to the procedure. And also talk to them about the level of awakeness that you will have during this procedure. The reason I say this is I have lost count the number of times that I have rolled a patient in and we're putting them on the table and they say, when will I talk to anesthesia? Will I be completely out for this procedure? And considering I'm a nurse, I'm not an anesthesiologist, the answer will be no, because some procedures are moderate sedation only, which means there is no anesthesia, which means a nurse is monitoring those medicines that you are taking. So if you are expecting to be completely out during the procedure, you need to make sure you clarify that with the doctor prior to the procedure. Waiting until we are rolling you into the room it's too late to clarify that, because at that point the procedure is already rolling, and you either have the decision to say you want to refuse, and then it's going to cause a delay in your care, cause a delay in that procedure and when they could potentially do the procedure. So if you think in your mind, oh, I'm going to be completely out for this procedure, you need to make sure you clarify that with your doctor, because it could be a situation where you will be under moderate sedation, which means you can be awake, which also means that there is no anesthesiologist monitoring you. It is a nurse only during that procedure. 5, be an active participant in your care. And one way you can do that is by helping to decrease your risk for infection. All invasive procedures come with a risk of infection because they are making an incision or they're doing a poke into your skin, so that opens your skin up to being susceptible for infections. HIPAA cleanse, this is what it looks like. You can shower and just clean your skin with this the night prior to your procedure, and it helps to decrease the amount of bacteria that lives on your skin naturally. This can help decrease that, which then that helps to decrease your risk for infection. So if you know you are having an invasive procedure and you want to make sure you put yourself at no risk of developing a post-op or post-invasive procedure infection, use HIPAA cleanse. You can get this from CVS, you can get this from Walmart, you can get this from any store that sells medical procedural items. And use this the night before just one shower. It helps to decrease the bacteria on your skin and therefore helps to decrease your infection risk. Thanks for watching my video. I hope this helps you. If you have any questions, please leave them in the comments. And as always, swallow the pill.